Welcome back to Face the Nation. As long as the virus circulates around the globe, it remains a threat. According to the World Health Organization, more than 30 countries have not yet started vaccinating their population, including almost, as you can see there, the entire continent of Africa. COVAX is the largest global vaccination program in history and aims to distribute donated vaccines to countries that may not be able to purchase them. Dr. Seth Berkley is the co-head and joins us from Geneva, where it is into the evening on Sunday. Thank you for joining us.
Thank you for having me.
We're talking about that global immunity gap here. April 7th, that's Wednesday, is when the World Health Organization wanted all countries to begin administering vaccine. Is there any way to meet that goal?
Well, we are on our way. We've vaccinated 84 countries or brought vaccines into 84 countries over the last about 6 weeks. We hope to get over 100 in the next couple of weeks. But I think the big challenge here is the inequity that we talk about between developed countries and developing countries. Of course, as you said, we are only safe if everybody is safe. And nothing tells us this like the new variants, because if we have large populations that are not vaccinated, then there is the risk that we will see new variants pop out and they will continue to spread across the world, as we've seen with this virus has been able to do up until now.
So the first COVAX provided doses began arriving on the continent of Africa in February. But as we just saw on that map of the 54 countries, I mean, there are big deserts here, essentially, where vaccine doses are not being distributed. What is the biggest impediment? Is it supply, or is it the logistics to deliver shots and arms?
So the logistics have come along. Of course, we work, the Gavi Alliance, which I head, is a public-private partnership that works to provide vaccines for developing countries. And we provide about 50% of the world's children with vaccine. We've been able to launch 500 vaccines over the last 20 years. So the logistics is not bad. The big challenge right now is access to vaccines. We have gone ahead and placed orders for more than 2 billion doses, but the majority of those are coming in the second half of the year. And in the first half of the year, because of vaccine nationalism, has meant that there are less doses available. So that's our biggest challenge now. If we had more doses, we could make those available.
Vaccine nationalism, you're talking about governments essentially favoring their own population rather than shipping necessarily their doses abroad. The outbreak in India, I know, has caused some real slowing of their exports. How badly has that set you back?
So India is, by volume, the largest supplier of vaccines for the developing world. And because of the new wave of outbreaks in India right now, the Indian government has stepped up their vaccination programs. And that has meant that they've required more doses, which means that they've made less doses available for the rest of the world. We had expected in March and April about 90 million doses, and we suspect we'll get much, much less than that, and that is a problem. But we're in a race because we also see wealthy countries beginning to cover much of their population. And our hope is that they will begin to make their vaccines available to the rest of the world, including ones that they may not use. For example, the U.S. not only has Moderna, Pfizer, and J&J, but they also have vaccines from Novavax and, of course, from AstraZeneca. Those could be made available, and they would make a big difference in terms of the supply for the world.
Are you going to ask the U.S. government to donate its supply of AstraZeneca?
Well, the U.S. has been a fabulous supporter of Gavi and of COVAX, and they recently provided a very substantial financing of about $4 billion.
Right.
What we're talking about now is ultimately getting access to the large manufacturing facilities. I mean, the U.S. invested heavily at the beginning and has scaled up manufacturing and invested again and scaled up. Once the U.S. needs are met, those facilities really could be used to come online for the rest of the world, which could help stop the acute pandemic. Our goal would be, by the end of this year, to stop the acute pandemic, which is critical for global health security.
So President Biden, though, he has an America First vaccine policy, which is we will not ship our doses out and donate them until Americans are fully vaccinated. That is the policy. The U.S. taxpayer has provided about $4 billion, as you said. So what are you doing with the money you have now?
So the financing we have now is what we're using to pay for the more than 2 billion doses we've ordered. But as I've explained, many of those are in the second half of the year. And it really is critical for countries that are now seeing new variants spread and seeing acute disease for them to get vaccines early to protect their health workers, to protect their elderly and their most vulnerable. And that's really what we want to do as quickly as possible in every single country.
So is there an alternative to the U.S.? I mean, China has gotten a lot of attention for its efforts to push its vaccine. Russia is trying to sell its vaccine to countries in Europe right now. Europe's really struggling itself, and that is a wealthy area. Is there an alternative to U.S. supply, or do you really need America to step up?
So, I mean, there are many suppliers across the world, and it's not just the U.S. that has an opportunity to share doses they may not be using. So this is not about taking doses away from America. This is about strengthening America's global health security by taking advantage of some vaccines that may not be used. So it is unlikely, and Tony Fauci said the other day that he thinks it's unlikely that the U.S. will ever get to the AstraZeneca vaccine, given the supplies it has of the other vaccines. So if that's the case, and those vaccines can be made available quickly, that would then help other countries. For us, the challenge is making sure that the only vaccines that we use are ones that are of high quality and we know are efficacious. So we require stringent regulatory approval. And that is why it's taken some time, because as new vaccines come online, they have to go through that complex regulatory process to make sure they're safe and effective. Because if we had a problem with a vaccine, it could affect all vaccinations around the world. So we have to be very careful with safety as our key priority going forward.
All right, Dr. Berkley, good luck. We appreciate your time
so much.
today. We'll be right back with a lot more Face the Nation. Stay with us. Native American communities have seen the highest rates of coronavirus cases, hospitalizations, and deaths of any racial or ethnic group in this country. Jonathan Nez is president of the Navajo Nation, which considers itself the largest tribe by land and population and spans northeast Arizona, Utah, New Mexico, and Colorado. Good morning to you.
Good morning, Margaret, and happy Easter and happy Resurrection Sunday to all your viewers.
Thank you for that. Why have Indigenous people been hit so hard by COVID?
Well, Margaret, I think this pandemic here has revealed some of the deficiencies in all of our healthcare systems throughout the country, more so in Native American communities. Over 500 tribes throughout the country have been working hard to push back on this virus. And as many viewers may know, that the Indian Health Services oversees the healthcare system. And the Indian Health Service has been underfunded since its inception. And so we are, the healthcare professionals are utilizing the limited resources that they have, but then have been doing an outstanding job. And I want to say thank you to our healthcare workers here on the Navajo Nation, our frontline warriors, Indian Health Services, and the Navajo Nation employees for doing an outstanding work, pushing back on the virus, and as well as bringing confidence to the vaccine.
Mm-hmm. At the middle of last year, the Navajo Nation had a higher infection rate than any single state in the U.S. But you're saying you are, it seems, having some success with distributing the vaccine. How have you persuaded your community to take it?
Well, right now, the Indian Health Service, the Navajo area here, has received 246,000 plus doses. And of those, 219,661 have gone into the arms of our Navajo people. That's 89.3%. What was given to the nation are given to the Navajo people. 88,889 of our Navajo people are fully vaccinated. And I again, we just want to say thank you to our healthcare professionals. And we've been having town hall meetings. As you may know, we had Dr. Fauci on our town hall meeting, Dr. Burla from Pfizer, and just answering the Navajo people's questions about the virus, and also our leaders taking the vaccine on television. And I think just because of how hard hit the Navajo Nation was, we've seen a big increase in participation in taking the vaccine. So I really commend the people that have been fighting and pushing back on this virus. As you may know, Margaret, 30 to 40% of our Navajo people don't have running water here in the most powerful country in the world, and that has contributed to the high cases early on. But with the help of everyone, including our congressional delegation, our leaders, educating them, they have been forthcoming with resources, and we see that in the American Rescue Plan Act that has been recently approved.
That I just want to underscore that, because it was a shocking statistic when your communications director told us that 30 to 40% of your people do not have running water. Do you have assurances on how the money will be spent, this federal aid that you're talking about? And added to that, the Biden administration still doesn't have an appointed head of the Indian Health Services. So why are you so confident these things are going to be addressed?
Well, the acting director right now, Elizabeth Fowler, has been working directly with the Navajo Nation, as well as we've been working straight with the White House. We have finally have a seat at the table here in getting our information and our advocacy addressed. And it's a really, with the funds that are coming to the citizens of this country in terms of recovery and rescue, this time around, it's finally helping our nation grow. And it's all about nation building here in Indigenous communities throughout the country, and really focusing on self-determination. Our economy has been hit hard because we were able to implement some very strict protocols. We had lockdowns, we have a mask mandate, which hurt our economy. But we are moving out of that high cases. And just a couple of weeks ago, first time ever in 6 months, we had 0 cases and 0 deaths in 24 hours. So I commend the Navajo people for listening to the healthcare professionals and their leaders. And I wish that other jurisdictions throughout the country would do the same.
The CDC says Native Americans are twice as likely to be diagnosed with diabetes, have a greater prevalence of obesity and alcoholism, and are more likely to be smokers. All of these things are a recipe for susceptibility to COVID-19. What are you doing to promote a healthier lifestyle?
Well, in Indigenous communities, we are returning back to a lot of our teaching. If you look through our world lens, our world view, a lot of our teaching can really push back on these health issues, some of these, we call them monsters here on the Navajo Nation, these modern day monsters: alcoholism, drug addiction, suicide. And we are really encouraging our Navajo citizens to return to some of our teachings, our way of life teachings, so that we could be able to push back. And I think that is one of the big reasons on the Navajo Nation we were able to push back on this virus. It wasn't about restricting people's freedoms when we told people to wear a mask or to stay home. It was looking at the greater good. And the greater good here was to protect your family, protect your community. And I think because of that, we were able to let our people know that we will get through this pandemic, just as we have gone through some very tough times in our history. And all Indigenous peoples, I guess all 5 finger beings, have some difficult times in their history, and more so in Native American communities. But I just want to highlight, Margaret, that Indigenous peoples throughout the country are very resilient, even though sometimes the federal government is slow to react in Indian country. But we didn't roll over, we didn't give up. We fought hard, and I commend Navajo citizens for doing their best to push back this virus.
All right, President Nez, good luck. Thank you for your time
Thank
this
you.
morning. We'll be back in a moment. Arrivals of unaccompanied children at the southern border reached an all-time monthly high in March, and the pace of migrants crossing the border does not appear to be slowing down. Sister Norma Pimentel is executive director of the Catholic Charities of the Rio Grande Valley, and she joins us this Easter morning. Happy Easter, Sister.
Thank you, Margaret. Thank you.
So for our audience, I just want to describe your organization, the role you play. You provide assistance to migrants who are seeking refuge here in the U.S. They often meet you after they've been released from U.S. custody and told to come back for a court appearance in the future when they're asking for asylum. I'm wondering, since you have been on the border for so long, what are you seeing with your own eyes right now? What are migrants like when they are arriving here?
Yes, what I'm seeing today is what we've seen already for several years back, surges of families arriving to our border that leave their country because what's happening in their country has not changed. It continues to be a place where they are afraid to be there for their children. And so what we see a lot here at the border, since 2014, we saw it in great surges, children unaccompanied and families, moms with their kids. And even in 2019, throughout up to in today, it's no different. We're seeing it again. And so it's just families that are hopeful that entering the United States, they may be safe, and that's what they're looking for. And it's not different. And that's why we have so many children in here at the border as now again.
What state are the migrants arriving in?
You know, the conditions that they arrived, in 2014, it was devastating what I was seeing with the families and the children dirty and muddy and crying and dehydrating and scared. And today they definitely are. You can see it in their faces that they're scared, that they've been through so much. Um, but they're hopeful, hopeful that maybe now they have a chance to be somewhere safe because they have been through a lot. This journey that they take from their country through all along the path they go through, people taking advantage of them. You can see it in their faces and what they've been through, and having to wait in Mexico for so long also makes them very vulnerable and at high risk.
What you are referring to there is the so-called Remain in Mexico policy that President Biden just lifted when you said they were asked to remain there. As you know, immigration is so politically fraught, and President Biden has been heavily criticized for lifting that Trump-era policy, also for allowing migrant children who arrive unaccompanied to stay here, even though on paper the policy is to push back during the pandemic anyone coming to claim asylum. I know you're not political, but I'm wondering what you think is driving migration right now. Is it the message from the U.S. or is it what's happening at home?
You know, the message from what is happening in the United States is just utilized by those who take advantage of these families, who exploit these families, who try to use whatever's happening here to convince them that whether it's no matter who it's in office, no matter what's happening here, it's used to their advantage to get these families out and encourage them to come, and because they're desperate to leave their country because of the situations that are there. It's almost as if we've never seen it addressed. The root causes why these families come are going to continue to come, and we're going to continue to see these surges and these great numbers of children, especially children here at our border. And the traffickers, they use this to their advantage. And so it doesn't matter who is in office or what is happening here. The message is twisted and used for their advantage. And so I think that contributes a lot why these families are all of a sudden surges at some points and then others, and of course there's so many factors involved, but that may be one of them.
The Biden administration has outsourced a good deal of the COVID testing to local agencies and to organizations like yours. I know you have to provide a lot of these services. How challenging is that? What kind of resources do you need?
There's so many families arriving, so many children. And so being able to provide hundreds and hundreds of toothpaste, toothbrushes, just basic things a person needs just to be okay it's a challenge in itself. But thanks to the generosity of so many people that reach out and say, how can I help you? And even the present government is reaching out and wanting to help as well. So I think that together we can respond and we can address what is happening at the border. And that's what's happening right now. Definitely the numbers are high. And I can see why the children are not being sent back, because of the fact that they run a big risk. You have to keep the child safe. And especially if they're unaccompanied, you cannot just send them back like they're sending everybody else. They have to be protected. They need to be processed correctly to make sure they are handed over to the right family member. And so that's why we're seeing such high numbers of children right now.
Time magazine referred to you as the Pope's favorite nun. I know when you met him a few years back, you presented him with a painting of a mother and child. I wonder what your message to him was about this unique part of America, and whether you would like the current president and vice president to come down and meet with you at the border.
I always encourage everyone to come down and see for themselves, because if you get close enough, like I get close enough to the families and accompany them and see for yourself, you can be able to really, truly understand better what is happening and feel what I feel, so that we can reach out to help, because honestly, this should not be about politics. It needs to be about people, because that's what we're seeing here at the border. And the Holy Father's recognition was recognizing all of us doing what we were doing, to where we reach out to those that we see before us suffering. And so I certainly hope that our president joins us and comes down and accompanies us, so that he can see for himself.
Thank you, sister, for your time today. Good luck to you. We'll be right back. We will continue to explore inequity in America as best as we can, and we will try to look at solutions for closing the gaps. Thank you for watching, and wish all of you who celebrate Easter a very happy one. We'll see you next Sunday. I'm Margaret Brennan for Face the Nation.